Many of us may have cancer in our lifetime, and today cancer patients are sharing their stories to save future lives.
Yeah, it's all part of President Joe Biden's Cancer Moonshot Initiative. Matt Stewart is live at Gilda's Club, KC, where a listening session is going to start there at 9 o'clock this morning. This sounds pretty intriguing, Matt.
Yeah. No, exactly. Federal officials from the Department of Health and Human Services will be here. And that's what President Biden had said from the beginning, is it's important that the government listen to cancer patients, listen about their journey so they can better the treatment and better the outcomes. And to talk about this, I have the executive director of Gilda's Club, KC. This is Siobhan McLaughlin-Leslie. Thank you for joining us. And first of all, how exciting are you to be able to host this listening session?
It is really an honor. I understand that it's the first in the United States listening session for the Biden administration. We will have Dr. Catherine Young here, who is the Assistant Director of Policy and Outreach for the Cancer Moonshot Project.
We had talked about this. What are kind of the things that you hope that get told to these federal officials that are here today?
I think what the federal officials really need to understand, one, is how very prevalent the incidence of cancer is in our community, how debilitating it can be to a family, but more importantly, that there are some levers that can be pulled in order to meet that goal of decreasing deaths by 50% in 25 years.
I know we had talked about early detection being very important with that.
Absolutely. So early screening, screen early and often, as they say. Number two, clinical trials. How important are clinical trials in discovering different modalities and better ways to control cancer so folks live well with and through a cancer diagnosis?
But that can be scary, right? You think about a clinical trial, it's an unproven drug. Am I going to get the drug? Am I going to be in the control group? And that it takes a lot of convincing cancer patients to be a part of a clinical trial.
But it's important for them to know that everyone gets care. It may just be a little bit different care or an additive care. And then thirdly, there are disparities. There's cultural disparities, there are disparities in treatment, there are disparities in outcomes. So we'll touch on those a little bit in a kind of level setting part in the morning, and then just go in and do a listening session for those three topics, most importantly.
Do you think that what cancer patients here in Kansas City say today is going to make a difference when it comes to setting cancer research and treatment policies in the future?
Absolutely. Joe Biden said we need to start by listening to cancer patients and survivors and better understand their situation. And so I think that will have a huge impact for tomorrow.
Siobhan, thank you very much. And I mean, how exciting, guys, right? The first listening session in the nation right here at Gilda's Club KC in Westport in Kansas City. Cancer patients will be here. Cancer supporters will be here. And so, yeah, they're going to be sharing these stories to these federal officials with hopes that it will make for a better tomorrow.
Wow.
Guys.
We have so many cancer resources right here in Kansas City. It makes sense that we would be the first to host something like this. So thanks,
Very
Matt.
cool.